So this is a video regarding a patient who came into our emergency department with bad right lower quadrant pain. She had a very large mass on an ultrasound and a history of having had an ovarian cyst about a year previous, which was just being watched. But her pain was severe enough and she had a mass, so we decided to take her to laparoscopy. And as you can see here, she has a huge right paraovarian cyst and is completely necrotic. That dark appearance is a necrotic ovarian cyst. That little nub is actually the right fallopian tube, which is draped over the cyst. That tells us this is a paraovarian cyst. It's a Wolffian duct remnant cyst attached to the ovary. And you'll be able to see here this little nodule at the bottom of the cyst on the right there. That is the dead ovary. And the rest of this mass is the paraovarian cyst. And this was so big that we really couldn't approach it through laparoscopy. So we went ahead and opened and dissected out the right ureter, found the right infundibulopelvic ligament, and removed this entire mass. So this case is a good example of how patients with ovarian masses and acute pain often, and in fact, until ruled out, have ovarian torsion. And that's exactly what this patient had. She had severe pain, a large mass, and we took her to the operating room, which is really what you really should be doing. There's not a lot of place for observation in these patients, in my opinion, because they almost always have ovarian torsions. And that's what she had. It's nice when you can deal with them through the laparoscope, but in this case it was just way too big to do that. So we put in the scope, saw that we weren't going to be able to deal with it, went ahead and opened and took care of her problem. She felt great the next day and was able to go home in 2 days. So patients with ovarian masses who have acute pain usually have ovarian torsion. Don't wait, operate. You'll make them better.